Heartburn is common. Most patients with heartburn are just miserable. But occasionally, when they let heartburn go too long, some patients will get complications. Those complications can include stricture formation, where the scar tissue that forms in the lower esophagus is a result of acid bathing the lower esophagus for a prolonged time. Food initially sticks in these patients, and sometimes it will wedge in their throat to where they have to seek emergency attention. So a stricture is one of the bad problems that can come from untreated heartburn. Another problem is something called Barrett's esophagus. Barrett's esophagus occurs, again, after a long time of acid bathing the lower esophagus. The tissue can start to change. So it's not the normal tissue that you would expect to find in the lower esophagus, but it changes to something different as the body is trying to protect itself from the acid. That changed tissue is actually a precancerous, pre-malignant condition known as Barrett's esophagus. Those patients who have Barrett's esophagus are at a greater risk to developing cancer of the esophagus. Cancer of the esophagus is actually one of the cancers in our society that is growing at an alarming rate. It's becoming more and more frequent. We're seeing more of the complications of chronic acid reflux disease.